Do you worry your teen is gaining weight quickly or seems hungry all the time? Are you afraid this could lead to prediabetes or diabetes later in life? That's why I created the Healthy Weight Starts with Healthy Habits, a 7-day hormone reset program for teens. In just 7 days, teens begin to understand their hunger signals, learn how to build meals that keep them full longer, improve their sleep habits, and feel more confident making healthy choices. Instead of guessing what to do, your teen will have a clear starting point and simple habits that support their metabolism and long-term health. You can learn more at lifestyleforteens.com/reset.
This is the Lifestyle and Weight Loss for Teens podcast. If you're a mom and want to help your child who is struggling to lose weight, you are in the right place. If you are looking for healthy lifestyle tips, Dr. Gourgari is here to help you understand the science around safe weight loss in teens and children. Because what works for adult weight loss is not always the best for children. This podcast is for educational purposes only. Dr. Gourgari does not provide medical, psychological, or nutrition therapy advice. You should not use this information to diagnose or treat any health problems without consulting your own medical practitioner. And now, your host, Dr. Jenny Gourgari.
Welcome to another episode of the Lifestyle and Weight Loss for Teens podcast. And on today's episode, I'm going to talk about prediabetes and the root cause of prediabetes. What is the root cause of prediabetes in adults? What's the root cause of prediabetes in teenagers? Is it the same? Let me answer this question. So sometimes it is the same root cause for both adults and teenagers, but teenagers have an extra reason and an extra factor that may predispose them to prediabetes, and that is their insulin resistance of puberty. Now, let me step back for a second and explain what is the normal physiology, what happens in your body when you eat sugar. What happens in your body is that there is a spike of a hormone called insulin, and the insulin is normally produced in the pancreas. It's an organ right below the stomach. And when insulin is produced from the pancreas, it brings the sugar down. So every time that you eat anything that has high sugar, let's say that is pasta, has a lot of carbohydrates, you can have a dessert, you can have bread, you can have rice, you can have pizza, anything that has carbohydrates that in your body when you eat it becomes sugar, that causes an increase in the insulin. Now imagine if you do it again and again and again, the body has to produce lots of insulin if you eat lots of those things to make sure that your sugar is low. Now, the insulin is produced by the cells in the pancreas that are called beta cells. So those beta cells are working perfectly fine in the beginning of everybody's life, unless there is a genetic condition. But eventually, if they have to overwork because the amount of insulin they produce is enormous, and that happens for years and years and years, there comes a point where those beta cells of the pancreas cannot produce the same amount of enormous insulin. So they start to get tired. The stage where those beta cells produce a lot of insulin is called insulin resistance. That's when you see very high levels of insulin, but the sugar is normal. So the sugar is normal, but at the expense of your body working very hard to keep that sugar normal. And if nothing happens, then eventually the beta cell gives up and says, you know what, I cannot do this anymore. Like, even though the beta cells produce a lot of insulin, it does not work anymore. It's not enough anymore. And that's when you start to see the sugar increasing, the glucose in the body starts to increase. When you start to see the sugar increasing, that's when you have prediabetes. Prediabetes means it's not to the point that you have diabetes yet, it's not super high, but it's not also normal. So that's in between the stage of having normal metabolism, normal sugar, normal insulin versus having diabetes. So it's a stage, prediabetes is a stage before you get diabetes. What is that stage? What is the stage on when is the diagnosis of diabetes being made? That means if your fasting blood sugar is more than 126 milligram per dl, or if randomly you check your blood sugar and it's more than 200, or if you do a specialized test that's called hemoglobin A1C, and your hemoglobin A1C is more than 6.5 or above, or if you do a specialized test where they give you to drink 75 grams of sugar and then they measure your sugar at different intervals every half an hour, and after 2 hours, your sugar is more than 200. So that is the definition of diabetes. And prediabetes is if you have blood sugar between 100 and 125, or during the OGTT, this test where you give sugar, if your sugar at 2 hours is between 140 and 199, that's prediabetes. Or if you do a hemoglobin A1C, if your hemoglobin A1C is between 5.7 and 6.4. So the root cause of prediabetes is, in a sense, dysfunction of the beta cells of the pancreas. Now, the question is, why are beta cells dysfunctioning? Why can they not keep producing more and more insulin? What are the risk factors that for some people, the beta cells give up, and for some other people, they work fine? The main and most important risk factor for beta cell dysfunction is if there is extra weight gain and extra fat tissue. Particularly the fat tissue that is around our belly, that's called central adiposity, or belly fat, or visceral fat. You may hear different names. They all point to the fact that there is extra insulin resistance, and the risk for prediabetes and diabetes is significantly higher in those people that have their fat distributed around their waist. Now, other risk factors that can make those beta cells fail is if there's like family history of type 2 diabetes. If there are a lot of family members, that means there are certain genes and there's some genetic predisposition that, even though you may not be as overweight as some other people, and even though you may eat healthier than other people, you may be at higher risk for prediabetes if you have the genes that can predispose you to have prediabetes. Now, there are also certain ethnicities, like we know that people that are Black race, Native Alaskan, Latinos, they have predispositions, like they are higher risk to develop prediabetes and diabetes compared to white people. And of course, there are also genes that have nothing to do with all those things, but they are genes that predispose you to have certain types of diabetes and prediabetes that has nothing to do with your race, has nothing to do with your weight. And this is like a very different risk factor. And those people is a different category of like why they have beta cell failure. Now, what is more important for people to know, and what I want you to know, is that the most important modifiable risk factor is really the lifestyle, your weight, the fat distribution. This is something that it is in your power. It is in everybody's power, in teenagers, in adults, to change it. Like, you can't do anything if your mom had gestational diabetes, or if your mom has diabetes, or your dad or your grandpa. Or you can't do anything if you are Black or Hispanic or you have certain genes. However, it is in your power to change your lifestyle to improve the beta cell failure, because if you remove the excess adipose tissue, the excess fat tissue, especially the one that is around the waist, then what happens to the insulin sensitivity? It goes up and the insulin resistance go down. So as soon as that happens, then you don't need as much insulin for the same amount of, let's say, pizza. So if you have a certain piece of pizza, let's say one piece of pizza, and you have insulin resistance, then let's say your insulin may have to increase up to 100 to control that sugar from the one piece of pizza. But if you are in a normal weight and you don't have insulin resistance, then your insulin only has to increase to 30, for example, for the same amount of pizza. So it is in your power to change your lifestyle and improve your insulin resistance, make your body more insulin sensitive by removing the extra adipose tissue. Now, other things that can have the same effect is also if you exercise. Well, as soon as you exercise, your body, your muscles immediately become more insulin sensitive. That can help significantly with the risk for prediabetes. Eating healthier, exercising more can improve immediately their prediabetes risk. There are other things that I have talked again that have to do with sleep modification. If you're not sleeping well, that can also affect your insulin resistance. And also the quality of the food versus you're having whole grain, let's say, versus refined carbohydrates. That also plays a role. There are many other things that play a role. And that's why I create all these episodes to educate teenagers and families about the risk of prediabetes in teenagers, what is the root cause, and what can people do about it so that we avoid the diagnosis of diabetes. Another thing is that, particularly for teenagers, why is insulin resistance more? It has to do with hormones that are in puberty. So if you have a teenager that is in puberty and they have, let's say they're not exercising, they're spending a lot of time in front of video games, in front of the TV, that takes away the insulin sensitivity because of exercise. Then they eat a lot of unhealthy snacks or a lot of refined carbohydrates, then you take away then the benefit of having good quality of nutrition. They also don't sleep very well. They often stay up late, they wake up early, and then they take naps, long naps during the weekend. That is another risk factor. Then you have teenagers also that they go into the growth spurts. So they have high growth hormone. So this high growth hormone can create an additional insulin resistance, like it can affect it by 25-30%, make it worse just by the fact that they are in puberty, they're growing. So you have another hit because of that. And putting all those things together, that is the reason why, unfortunately, the prevalence of prediabetes in teenagers is very high. Is now 1 in almost 3 teenagers in the United States have prediabetes. But I always want to point out the optimistic point. The good news is that there is hope. This is a reversible condition, like almost 30 to 50% of teenagers can get back to normal levels with lifestyle modifications and in certain cases with medications as well. Now that you understand what the root cause of prediabetes is and what helps with insulin resistance that helps prevent the progression from prediabetes to diabetes. I invite you to go and do those things. You can do them on your own. I also have a coaching program where I help families that need some support to get through this phase with lifestyle modification. You can go to lifestyle14s.com and don't stop working towards healthier habits. Small habits that are persistent over time can have huge results. People often get disappointed when they try something for a month, it doesn't work. This is not a sprint. This is a lifestyle change that will change your whole trajectory for the rest of your life. So I hope this was helpful, and I'll talk to you soon. Take care.
If you enjoyed listening to this podcast, I invite you to come check out the LIFT program. It's Dr. Gourgari's 12-week coaching program for teens and their moms, where we take all this information, we apply it to your daily life, and we work together so your teenager learns how to create a healthy lifestyle so they can feel happier, more confident, less stressed, and love their body again. Visit the website at lifestyleforteens.com and click on the Work With Me and free resources to learn more about this program and get free help to start this journey right away. Thanks for tuning in, and we'll catch you in the next episode of Lifestyle and Weight Loss for Teens.